18-year-old college student seeks evaluation at the emergency department with complaints of fevers, chills, fatigue, diarrhea, and loss of appetite, which have lasted for 1 week. He says that his symptoms are progressively getting worse. He was taking over-the-counter acetaminophen, which was ineffective. The past medical history is insignificant. His temperature is 101.9, blood pressure 100/65. Physical exam is within normal limits, except that the patient appears ill. Eventually, a diagnosis of typhoid fever is established. She started on antibiotics. Which of the following cellular components is most likely to be responsible for the toxic symptoms in this patient? So is it lipid A, which is present in the bacterial cell wall? Is it toxin secreted by the bacteria? Is it pili on the bacterial cell surface, flagella, or an outer capsule? So you need to know the characteristics of the organism which causes typhoid fever. So this patient has been infected with Salmonella, and which is a gram-negative bacterium. Symptoms are fever, headache, constipation, malaise, chills, myalgia. Diarrhea is uncommon. So this is what the structure of the gram-negative bacterial cell wall looks like. They have an outer membrane, a peptidoglycan layer, and a cell membrane. And the most important component is the lipopolysaccharide layer. Okay, so the active component of the lipopolysaccharide in the cell wall of gram-negative bacteria is lipid A. So this is what the lipopolysaccharide looks like. It has three components. It has the O polysaccharide, the core polysaccharide, and the lipid A. So the lipid A is the one which is most pathogenic. It forms the innermost layer of the lipopolysaccharide component. It is a disaccharide with multiple fatty acid tails extending into the lipid membrane. It activates macrophages, leading to release of inflammatory mediators, particularly IL-1, 6, and TNF-alpha. So IL-1 is responsible for pyrexia or fever. You need to remember the functions of each of these interleukins. You will find this in your immunology section. So IL-1 is responsible for pyrexia. However, the toxicity of lipid A is only expressed when the cell undergoes lysis and fragments of the membrane containing lipid A are released into the circulation. Because the toxin is not actively secreted by the bacteria, it is known as endotoxin. So we have two kinds of toxins, endotoxin and exotoxin. Endotoxin is what is released when the cell lyses. Exotoxin is what the cell actively releases into the surrounding. And lipopolysaccharide, it is heat stable. It cannot be used to produce a toxoid. Endotoxin is an exclusive feature of gram-negative organisms. Okay, so this is very highly, you need to recognize the fact that gram-positives produce exotoxins, gram-negatives endotoxins, and what the major endotoxin component is and how it acts. So lipid A produces IL-1, which is responsible for the fever. If you just remember that much, most of your questions you will be able to tackle this. Okay. Just to cover some of the other pathogens as well. The pili or fimbriae, these act as pathogens by allowing adherence to the cell surface. These are seen with Neisseria gonorrhea in specific. Flagella is seen in Vibrio, E. coli, Proteus. They also help to attach to cell surfaces. And then there are some organisms which have capsules which protect them from damage, but it's not pathogenic as such usually. Okay, so the main takeaway point here is the lipopolysaccharide layer, which has lipid A, produces IL-1, causes fever, and the fact that it is an endotoxin.
Thanks for watching. Please give a thumbs up and subscribe for more.